Okay, hi. My name's Taizo Nakano. I'm a hematologist at the Children's Hospital, Colorado, where I am the medical director of our Vascular Anomalies Center. And today I have the privilege of talking to you about patient-reported outcome measures, PROMs, in complex lymphatic anomalies. So not PROs, but PROM as a subject for today. And although I've done some consulting work for Novartis, nothing should conflict with this presentation. Our objectives for today, we're going to go ahead and try to understand what are patient-reported outcome measures in medicine and how they apply to complex lymphatic anomalies. We're going to pitch a model for the potential impact of creating an electronic PROM profile for patients and discuss the implementation of one particular platform, the NIH Promise Measures, which we're hopeful to move forward in our field here to implement PROM as an outcome measure. So first and foremost, what are patient-reported outcome measures? Well, essentially, this is how the patient experiences their health. You give a therapy, and in your own words, how would you say that that therapy went? You could express that as something functional, like mobility, something descriptive, like pain, or potentially a mental health or psychosocial outcome measure, like anxiety. One could receive these measures from a patient, whether it's a child or an adult, a caregiver, or a proxy. One could generally categorize the type of information you could receive as health-related quality of life, symptomatology, or as mentioned previously, psychosocial functioning, like daily functioning, cognitive function. What are the important measures for our field? And I would say for complex lymphatic anomalies, as opposed to something like a cancer where the outcome is the disease was there and it's gone, lymphatic anomalies are congenital and they're lifelong. And so our outcome measure, I would argue, is the patient experience. How the patient experiences health is the most important measure. So we didn't have to necessarily start this conversation reinventing the wheel to say, what are the most important outcome measures in vascular malformations? I would really highlight the links at the bottom of the screen here. And if any of the audience are not aware of the phenomenal efforts in Europe by the OVAMA initiative to identify the most important outcome measures for patients with vascular malformations, I would visit their page and visit that publication. This is a slide taken from their website after they did a monumental study, looking at the input from both patients and caregivers to see what were the most important domains that could be used to measure outcome. And so you can see under anatomy, appearance was measured. Under symptoms, things like pain or some disease-specific measures were used. Quality of life, you could see there's a lot of functionality here, and satisfaction with treatment and outcome overall. These were things that they felt were important, both from the patient-related and clinician-reported aspects. And their effort, as I mentioned, didn't happen overnight. Another slide from their website just demonstrates the Delphi model, the multi-step model that was taken to incorporate both the patient advocate and provider experience into what are potentially the most important domains, outcome measures to look at for the field of vascular malformations. And so, it's up to us to decide how applicable this is specifically to lymphatic anomalies. But I think this is a really great start for us and potentially even the foundation we could use to build a composite panel of domains going forward to measure outcomes across different studies. Specifically thinking about the different industry trials that choose various forms of outcome measures, that if we could standardize that, potentially it wouldn't be so much comparing apples to oranges between trials, and we could actually move the dial forward on how we improve care. So I wanted to make a pitch that beyond just saying, here's your paper handout of another survey of what how you're potentially feeling about your experience. The implementation of using an electronic patient-reported outcome measure, I think, really demonstrates the power that you could use this clinically and in research. So a user through an electronic platform, being the patient, the parent, or the provider, could fill out any number of patient-reported outcome measures from any number of tools. And you can probably imagine that during clinical trials, it's not uncommon for patients or families to have to fill out several surveys over time. And that's usually balanced with something that we all know as survey fatigue, of how much you ask a family to undergo. The power in this, though, is can you create an electronic profile, an electronical way to view patient-reported outcomes so that it's actually helpful, that it impacts care? And does the provider actually use this information, take it back to the patient, and impact clinical care, and potentially retrospectively to clinical research, which is one of the goals as well. So this is just an example. This is taken from a presentation from the Mayo Clinic that has successfully implemented patient-reported outcome measures into their daily care. You can see that just as much as the physician is able to view in this dashboard things like a patient's vitals and the medications that they're on, you can also have general health questionnaires that measure physical functioning, pain, in this case, over time, to see, in front of you and make real decisions on the impact of the treatments that you're giving. So you not only have to have the surveys, but the medical record has to have this form of dashboard to make it useful. You have to make it user-friendly. You have to make it interpretable. But the power behind a dashboard like this in real time around your treatments is pretty important and pretty impactful. And I'm actively implementing a dashboard similar to this in Colorado. I took this from a recent presentation from a Dutch group that has implemented patient-reported outcome measures standardized across over 25 institutions in their country. And the way they've been able to coordinate and sync care because of this has really changed the dial of therapy. I was quite impressed and was thinking, if greater than 25 centers were able to sync electronically to incorporate patient-reported outcomes, then I really feel that North America could do this as well. And why shouldn't it be with lymphatic anomalies as the diagnosis that takes us there? So, what would it take for us to do it? Well, we've already started to make some progress. We are a field that wants to implement patient-reported outcome measures. Although there are several consortiums that could do this, currently within the campus consortium, we are starting to talk about how we can implement standardized PROM measures for complex lymphatic anomalies. This comes along with important support research-wise, registry-wise, and there are several important mentors in the field that can help us get there. One of the most important steps is going to be, what is the tool that we're going to use? Unlike several industry trials that have several different PROM measures given to patients throughout the trial, I think we'd like to narrow in on one composite, comprehensive measure that could be given to, again, cover the ground we need to, but stay away from survey fatigue. And I'd like to make a pitch that the NIH Promise Measures potentially is the tool that we'd like to use going forward. So the NIH Promise Measures have been around for over a decade. There are hundreds of domain scores or surveys. And one of the most important factors here is these are validated surveys across disciplines. So publications from cystic fibrosis to sickle cell disease have used NIH Promise Measures as the platform, the tool of choice. And it's very applicable for our field as well. They're customizable, they're standardized, and they're supposed to standardize the experience not only within your institution, but between institutions. And they have a very uniform and easy to use scoring method. What do we need help with in the community? How can we improve going forward using this tool? I think the increased patient participation and engagement is incredibly important, as this is a patient-reported measure. The way we integrate with electronic health records, I think you can see that this is something that I was really passionate about, that I think will help make this user-friendly, and more importantly, dashboards that allow us to use the information to change patient care. We need help making questions shorter, and reduce repetition over time. But it's a really important tool that we would like, again, to use in the field of lymphatic anomalies. So to that end, one of the projects we have going on in the Canvas Consortium is a protocol that is in draft phase that I affectionately refer to as Lullaby, or the Longitudinal Understanding of Lymphatic Anomalies with Bone Involvement. So, I won't go into in this audience what a lymphatic anomaly is with bone involvement, but to say that we really haven't had any prospective studies to look at what interventions impact outcome for this condition. And to be fair, we really don't know what the most important outcomes are. So to the third point here, in addition to collecting clinical, laboratory, and radiographic data, the quality of life data, the patient-reported quality of life data, may actually be the most important outcome measure for this population. And so why we standardize what pharmacotherapy regimen we're going to use in this protocol, which will be dual therapy, sirolimus, and zoledronic acid, we will follow over time points the clinical laboratory radiographic response, but also use NIH Promise Measures to follow what may be the most important outcome measure for the disease. This is really exciting, but honestly, getting down to what that one composite measure is, that one survey that's comprehensive and yet not tedious, that's the holy grail of what we're doing right now. I think if we solve that and utilize the Lullaby study to test this as a tool, we can expand it to other vascular anomaly populations over time. But we're thrilled to work with the community here and see if complex lymphatic anomalies is actually the rare disease population that teaches us how to use these tools. I would just like to thank everyone for allowing me to speak today. We're really excited. It's going to take a lot of effort. It's going to take a lot of family effort and patient effort. And so if anyone is truly motivated, feel free to reach out to me. My email is right there. Otherwise, continue with us enjoying the great conference. And I'll happy to answer any questions.